Coming up, Valentine's Day is tomorrow. So today we're talking about all things love, including what happens when love, loss, or stress takes a real toll on your heart. We'll look at broken heart syndrome, why it can feel just like a heart attack, who's most at risk, and how both medical care and mental health support can help you heal. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Well, we have all felt it. Heartbreak, a bad breakup, the loss of a loved one, a moment that leaves you feeling like you've had the wind knocked out of you. But for some people, that emotional pain can turn to a real medical condition, one that sends them straight to the emergency room. It's called broken heart syndrome, and doctors say it's more common than you think. Here's Alexis Del Cid.
First broken heart you ever had?
Of course I do. The first one and the last one.
How old were you?
17.
What was his name?
Brian.
It could be argued heartbreak is the one universal human experience, whether it's a bad breakup,
probably 22, 23 years old, it happened in college,
or the loss of a loved one.
I was really heartbroken when my mom passed away.
We all know that gut punch that leaves you feeling like you may never be right again. And Dr. Travis Love says in some cases, a true broken heart can have devastating consequences.
It can be quite traumatic, and people will end up in the ICU with this, and people can even die from this.
The University of Kansas Health System cardiologist says broken heart syndrome is real. The more technical name for it, stress cardiomyopathy.
Most of these patients present like people who are actually having heart attacks, so chest pain, shortness of breath. A lot of the data that we find on these patients, their EKGs and their cardiac enzymes, are very similar to heart attack patients.
Most of the time, Dr. Love, and yes, that is his real name, says broken heart syndrome is treatable and reversible with medications and time. So it turns out time heals a broken heart is not just an expression either.
And we are so glad to be joined now by cardiologist Dr. Shannon Hoos-Thompson with the University of Kansas Health System. She is live in our Olathe studio this morning. Good morning. How are you?
Hey, I'm great. Good morning to you.
Good to have you. And here in studio with us is psychologist Dr. Greg Nawalnik. How are you?
Great, Jess. How are you?
Good, good. Thanks for being here with us. Yeah. Well, Dr. Hoos-Thompson, I'm going to start with you. From a cardiology standpoint, what is broken heart syndrome, and how is it different from emotional heartbreak?
Yeah, so it's usually after a very extreme emotional situation. So it is a sudden death, unexpected death of somebody. Your own body like has a bowel obstruction or some other sudden change. And so it's brought on usually with a very severe emotional event, an unpredicted one. And we don't understand it perfectly, but we think it has something to do with the catecholamines like epinephrine that get released, and basically you feel just like you're having a heart attack and frequently go into heart failure. So it is a very sudden and severe, dangerous situation.
Well, you mentioned many of these patients think they're having a heart attack. So what symptoms might they see that a signal they need to come see a physician?
Yeah, it's like Dr. Love outlined, is they have pronounced chest pain, severe shortness of breath, really lightheaded, will even pass out. So you feel sick and you know it's not normal and something serious.
Dr. Nawalnik, from an inpatient behavioral health perspective, are holidays like Valentine's Day, really any holiday, are they tougher for people who are already suffering or possibly in the hospital?
Yeah, I mean, I think any time that you have an annual recurring holiday situation, it's just, these are opportunities for check-in, and something like Valentine's Day where there's so much emphasis on relationships or connection, some people that are already depressed and upset, this is an opportunity for them to sort of do a deep dive on themselves and really give that depressive voice a megaphone to really blast that I'm alone again and oh my God, and how are we not getting this right, and that sort of thing.
So what warning signs do you watch for in a patient who may be struggling emotionally, but maybe not saying it out loud?
So the biggest one would be anytime they start to disengage or pull back from activities that they used to enjoy. If you notice somebody that routinely would be part of a social circle or even family events that stops showing up, when they kind of pull back and start to withdraw and isolate, that's going to be a warning sign that's kind of a big deal, because that's when depression kind of has its hooks in the person already, and the more they pull back and isolate, the less external feedback there is that they can get that maybe things are better than they think. And when they get into that sort of isolation pit, it just becomes an echo chamber for those depressive and negative thoughts.
Do you ever have conversations with patients just about emotional stress and the potential damage it can do to your heart or just other aspects of your body?
Absolutely. I mean, there's a direct link between mental health and physical health, and it's a divide that's been arbitrary for years, that we've got medical and physical health and then mental health. They each impact each other directly, routinely, regularly. So we're always talking about pay attention, listen to your body. A lot of people get very caught up in their heads and feelings and thoughts, and we like to sometimes connect that to our bodies so that we're able to recognize it earlier and identify it for what it is, and then take those adaptive and appropriate actions that can head it off at the pass.
Dr. Hoos-Thompson, how do you determine it's not a heart attack, and why is that distinction so very important?
So it's difficult. One is cardiologists, as we begin to understand this specific condition, it helps, but it looks very much like a heart attack, almost indiscernible. Sometimes with the imaging, when we do echocardiograms or other imaging, we can kind of get a sense of this is probably what's going on. And then obviously just the story of when these people present, the story or the background you get when you talk to them about what's going on in their lives, a lot of times will strongly suggest this is what's driving it. Ultimately, you have to image the blood vessels and prove it's not a heart attack more than anything else. So a lot of times it's identifying the background of what brought them in and the situations they're living in, and you have to basically show that it's not a heart attack. It's not a specific test that you identify the stress-induced broken heart syndrome, but that you prove that it's not a heart attack, and then can treat it more specifically then.
So how do you treat broken heart syndrome? Is it reversible?
Yeah, almost 100%. So these people recover usually within about a week to a month, because ultimately your heart is basically stunned, where it temporarily doesn't work. And just stops pumping, especially certain areas. So a lot of it is just time and support. So getting through that initial phase where they have changes in drop in blood pressure and kind of get congestion from a circulation and heart standpoint. So it's stabilizing that aspect of it. And ironically, you treat it with love and support. So just support these patients. Sometimes you use some medications to kind of help with heart failure. We do use blood thinners because they're vulnerable to blood clots when their heart isn't pumping well. But it's all very transient. The heart's remarkable, it recovers, you just have to get them through it.
Dr. Jessica Hamilton studies how stress and emotions affect the body over time, and we asked her about how prolonged stress like caregiving, grief, or loss can build up in ways that people don't always recognize and actually trigger physical changes in the body.
Anytime we are under stress, our body releases hormones. So specifically, the most common one that we talk about is the HPA axis, the hypothalamus, pituitary, and adrenal gland. It's also called more commonly our fight or flight system. So that's that thing that lets us know that we're in danger, that we need to do something to protect ourselves. But when that HPA axis, that fight or flight system is activated, it releases a rush of hormones. And that includes cortisol, which is also known as the stress hormone. And that can have a lot of implications for our overall health, including our heart health. So it can increase blood pressure, heart rate, and over time, it can really impact how our heart is functioning. A lot of times when we're under a lot of stress, we might start experiencing, especially in a caregiver role or secondary to a breakup or something like that, you might experience things that are similar to trauma. So you might see things like nightmares or flashbacks, triggers, things that really bring back, whether that be the death of a loved one or what I could have done different at the job or with that partner. It also could be things like feeling sad, isolating. It could be hypervigilance, and it could be avoidant behavior. So if you start seeing those changes in your personality or your behaviors, you really want to make sure that you are engaging in either self-care on your own, with a loved one or other family member social support, and or even going to a professional to talk about what you might be seeing.
Well, be sure to ask your questions. Use the chat on YouTube or Facebook, or you can email the Medical News Network. That information is there on your screen. Dr. Nawalnik, are there behavior modifications that you recommend to your patients who are suffering from broken heart syndrome? What can they do?
So first and foremost, the gold standard coping technique that we want to use whenever the HPA axis, like Dr. Hamilton was talking about there, when that's involved, fight or flight, is deep breathing. And there's a reason for that, which is that whenever that is activated, our prefrontal cortex, the front part of our brain where the real us lives, turns off, and we go back into this mammalian midbrain where everything is extreme. So it's good, bad, friend, enemy, safe, dangerous. There's no gray area. And so if you imagine navigating a life, in 2026, where there's so much information, if you're back in living this extreme existence, it's going to be really easy to get triggered and tripped up and have your heart and blood pressure and everything increase. Deep breathing is it basically downregulates. It reaches in and turns off the alarm and downregulates our central nervous system to allow the prefrontal cortex to come back online and allow us to effectively process information. And it really brings everything back into focus, brings down our heart rate. So deep breathing, diaphragmatic breathing is the gold standard.
I remember we did so many segments during COVID. I learned my breathing techniques from you. I still use them today. And they work. I can feel it working. I mean, just when stress levels come up and anxiety comes up, I mean, something as simple as just those 3 big deep breaths. You taught me them right here, and they do work.
As I was reviewing stuff for this, I was like, having flashbacks to 2020 and 21. But,
right,
where
we were all in the same boat. We were all experiencing the same thing.
And it's not limited. It works for anybody, anytime, all the time. We never develop a resistance to it like we might with some medications. It's always going to be effective in that acute moment. And so we want our patients to be utilizing deep breathing and doing it the right way, making sure that it's a diaphragmatic breath where you feel your belly go out. If you put your hand on your chest and one on your belly, the belly hand should be the one moving, not your chest hand. And we want to, after taking that good deep breath and then letting it out slowly, wait until you have to breathe again. Otherwise, you might find yourself getting dizzy, like when you're at a checkup and they're telling you deep breath and exhale, deep breath, and you start to see stars.
Okay.
So,
And this is something you could do in the middle of the day, something when you're laying down at night.
I did it on the drive here this morning because I was kind of up against time.
Okay.
But it worked.
And it worked, and here you
just
are.
A couple deep breaths, made it, everything was fine.
Cool as could be.
It's a great reset.
So master the breathing, that would be number one. But are there medications prescribed for this condition?
I mean, I think there's a range of anti-anxiety medications that can be considered. Those are going to be for more extreme cases, and if you're having this a broken heart syndrome, I think you'll qualify as extreme, or whatever the circumstances seem to be extreme. But really, the deep breathing, if you're doing it right, I always talk to my patients and joke that it's natural Xanax. It does the same thing to our brain and our body as a medication, but it's not addictive and it doesn't have any negative consequences. But sometimes medication is the appropriate choice, so I encourage you to consult your provider.
You said like that natural Xanax, but you could feel that like there's like a release when you do it right. So highly recommend it. You do it right. So thank you for that. Thank you for that tip. Dr. Hughes-Thompson, do you see broken heart syndrome more in men or women, or maybe a certain age group?
Yeah, so both. So women in general, 80-90% of the conditions when we see broken heart syndrome, it's in women. And typically women in their 60s to 70s. So it's a middle-aged to later in life woman. That said, I've seen both. Men and women have this condition. And why? Don't ask me why, we don't know. We have, theories about why men and women have different dynamics, but no question that's the individuals we see it most in.
So when should someone get checked out?
When your body tells you to. So it really does come back to how you're feeling. The symptoms are real. There's a lot of reasons people get chest pain. There's a lot of reason that people get short of breath. But when you have these kind of symptoms, especially really severe and sudden, then yes, get in, let us look at you, let us work through it and help you get better.
So how is it monitored to make sure that it doesn't progress to something even worse?
So again, that initial presentation is usually at the most severe state. When it comes on, it's a shock to the whole body when the heart kind of shuts down or is not able to pump and work effectively. So the initial presentation is usually when we have to do the most. And honestly, we can see it recover in as early as 1 week. Sometimes it's more prolonged, about a month or 4 to 6 weeks is when we can recheck. Obviously, symptoms are going to get better as the heart recovers. And yes, we use different medicines. It's not really a specific medicine to the broken heart syndrome, but the fact that the heart is not able to pump or work effectively, we just kind of transiently kind of get you through that with various combinations. And ironically, we're on Valentine's Day, getting love and support and just making sure that we're paying attention and make adjustments as we need to. But usually symptoms get better. We can relook at things like echocardiograms and see the heart function come back. And in the majority of time, far and away, this recovers.
Dr. Nowalnik, when is it advised for a patient in a hospital to follow up with an outpatient psychologist?
Always. I mean,
it's never a bad idea.
No, if you've been inpatiently admitted, around mental health issues, we don't want that to be the end of it. They're like, okay, you're there, everything's better when you're pulled out of the situation. Mm-hmm. Then when you get back out, and the analogy I use inpatient a lot of times is the hurricane, that like the inpatient admission is the eye of the hurricane. You're safe there. But then when you leave, you're right back into the wall of the storm that brought you there. So we want to make sure that you have those external supports in the community, whether it be a psychologist, master's level therapist, anything, life coach, somebody that's there to support you and help you to sort of carry out the things that you've learned inpatient.
And to gauge how you're doing.
Correct. Yeah.
Right.
And also there's something to accountability, having sessions show up for, and it's another set of eyes that if you're not showing up for an appointment, we know that's an alarm sign. We've got to reach out, got to try to find and get you reconnected to services.
Well, prolonged stress, especially during caregiving, loss, or isolation, can build in ways that people don't always recognize. Once again, here is psychologist Jessica Hamilton.
As they are in that caregiving role for months, taking care of, in your scenario, a loved one, that compassion fatigue that they can experience along with that stress hormone, that cortisol being elevated for a prolonged period of time, it can also mess with sleep, your metabolism, your immune system can weaken. All of these kind of combine together to actually put you at risk for heart disease, like cardiomyopathy for a short period of time.
Are there behavior changes or coping strategies you recommend to protect both mental health and heart health?
Absolutely. I mean, the deep breathing piece, certainly there. But also when we think about, as Dr. Hughes-Thompson was saying, the impact of these major emotional situations, a lot of times this can be some injustice has occurred in a relationship, whether it be romantic or family or whatever, that somebody feels that they've been absolutely backstabbed and blindsided and just overwhelmed. So one of the things that's in the literature that's very helpful is, and this is going to sound bad to some people, but the idea is forgiveness. And when we talk about forgiveness, it doesn't mean just disavowing the person of any responsibility or accountability, but it means instead for you as the individual that's been wronged to be able to look at the situation, look at the individual, see them as more than this singular act, and actually extend an invitation to them to try to be more of the good parts of them instead of just limiting with this one negative act. There's an old adage that harboring a grudge or anger is drinking poison, expecting the other person to die. And I think that's exactly what we're seeing in broken heart syndrome when it's that type of a situation, because you're the one that's carrying this weight. It's so heavy and it keeps you in that triggered state that it puts a toll on our body. That cortisol hormone kicking through your bloodstream, it erodes our physical wellness. And so taking that step to adaptively forgive and grow as a result of it, that's a real amazing opportunity that we're given.
Let's get to some questions from our viewers this morning. Amanda is asking if any of the fitness trackers, Dr. Hughes-Thompson, can help alert you to this condition.
The answer is no, not really. It is going to be your physical symptoms. So you may see a change in heart rate or things like that if you're using some sort of smart device, but it is going to be how you feel. Those things, again, we can get hyper acute to those things. So everything has a role, but that's really not something that this has been proven or consistently is going to help.
And Jeremy is asking, Doctor, do you see differences in who gets broken heart syndrome or how it affects them between young, old, male, female? Just the effects.
Not necessarily. The symptoms are fairly the same. And again, it really is kind of that 60, 70-year-old person. Do we see people older or younger than that? No question. Do we see men? Do we see women? Yes, predominantly it's women. It can be anybody. Again, how severe the effect is and how prolonged it is, no question there's a range there, but there's some pretty consistent things as far as when we see it and identify it and manage it.
Okay, Joellen has a question. Any relation between this syndrome and menopause?
Not directly. It is more postmenopausal women that develop it, but these are postmenopausal women that are usually, 10, 20 years after menopause. So it's in a certain stage of life, but not directly with menopause.
Jill wants to know, if you have a heart attack from broken heart syndrome, does that make you prone to heart problems for the rest of your life?
So anybody who's had broken heart syndrome once or the stress-induced cardiomyopathy can be more vulnerable to it to come back. But other heart problems such as, heart attack, other atherosclerotic events, not necessarily, because it's not driven by plaque or things like that we see with those conditions. So it's a totally different phenomenon. Obviously, if your body can have that kind of release in these hormones or drivers that are not directly in the blood vessels, they're also obviously prone to it again, but it's not really other cardiovascular conditions that we see come out.
All right, Dr. Wallach, you are up. Jeremy wants to know, does anxiety or depression, if you already have that, any other neurological things make you more vulnerable to this that you know of?
I mean, obviously the more often that we have that HPA axis get triggered, that fight or flight response, that can open us to a range of different health conditions. But at the same time, I want to, calm Jeremy and anybody else who's listening and thinking like, oh my God, I'm already this. Am I doomed for this? I think that if I'm not missing my guess, I don't want to overspeak into Dr. Thompson's specialty, but I think that this level of a physical response is very pronounced. I think that it's not typical. So I wouldn't, I don't want to give an anxious individual something else to be anxious about with this. I do think that if you're concerned about it and you're having enough anxiety to ask a question like that, or if this question rings with you, then I think it might be time to consider reaching out for some professional support, get some better adaptive coping skills on board, and learn what is at the heart of this anxiety, mild pun intended, sorry, and figuring out how to take active engagement in your life to empower yourself to move beyond this.
Alan is asking how you help a parent with the loss of a spouse when you're worried it's taking a toll on their health. Okay.
So I had to follow the flow.
Right.
Parent with, I think that it's about engagement. The more that we can reach out, the more that we connect, giving them a space to process those feelings, not making them feel like they're on an island. They've lost the most important person in their life, and now they feel like a burden to reach out to you. So know that it's going to have to come from outside in, rather than because there's a lower likelihood of the grieving spouse to reach out than there is the value or benefit in family members proactively reaching out to them and doing it in a way that doesn't seem like, hey, we're checking in, are you okay over there? Instead it's, hey, let's go get a coffee. Hey, what are you doing this weekend? You want to come over for dinner? Hey, we got this going on with the kids. Why don't you come see them? They miss you. Anything like that, where we're engaging them and supporting them and making them feel special and not alone. That's going to be the key.
Actively checking on people.
Absolutely.
I like that.
Yeah.
Okay, Jean, I love your question, because if you didn't ask it, I was going to have him do it. So Jean is asking, can you review the breathing technique? Okay, so show us
Sure.
how it's really done.
All right, so you put one hand on your chest,
Okay.
one hand on your belly, and you're going to take a deep breath in, and you feel this hand go out. And there's a lot of different techniques out there. People will say like how long you should breathe in, how long you should hold it, how long you should exhale. I don't love that stuff because it gives us something to anxiously track in terms of numbers. I want you to just take a deep breath in, as deep as you can get, hold that breath for about as long as you can hold it, and then slowly exhale. Once it's all the way out, wait until you have to take another breath, then take that deep breath in again. Hold it for typically a 4 or 5 count, like 1 1000, 2 1000, 3 1000, 4 1000, 5. That's pretty good. Slowly exhale. And already, I don't know about you, I feel good.
I feel great.
So just wait, and then until you have to take another deep breath, only do 3, maybe 4 sets of that. And then from there, allow yourself to just breathe calmly as you normally would.
I do that several times a day if you need to.
Absolutely, that doesn't run out.
All natural.
Yeah.
Okay, question. Drew asked, what advice or what symptoms should we watch out for if a loved one is going through a lot emotionally? Okay, you kind of answered that, but any other advice you have?
I mean, I think any variation from baseline is going to be important to notice. And what that's going to do also, not just giving us the sign, but when we notice something's off and we report it back to the person, they feel seen. And that's really important for them to know, like, wow, I never knew that you actually paid that much attention to me. Because when we're depressed, we don't think anybody cares. We think everybody's life would be better without us. So when we can demonstrate to the individual how important they are and that we actually see them, that's really beneficial. So noticing any baseline variance and reaching out and saying, hey, you okay? I noticed, you haven't laughed once, or you've been really quiet today. And you don't have to do it in front of everybody. You can pull them aside just to make sure so you're not putting them on the spot, and just let them know, hey, I'm always here for you. I got you.
That could change everything, just asking.
Absolutely.
Dr. Thompson, Greg is curious how many cases a month, a year do you see of this?
I would say it's not uncommon. We see, every month or two we'll see cases. So I would say it's not uncommon. I would tell you other conditions are more common, but I don't know if we have an exact frequency. Maybe 2 or 3 out of 100 acute chest pain that is cardiac related is probably stress-induced cardiomyopathy.
And just last question for you, Dr. Thompson. Carolyn wants to know if stress can slow down the healing process.
So stress is a big word, a broad term, right? So different stressors, no question. So if you're not focused on healing, have positive interactions, and physically, if you have stressors in your body where the body isn't able to function appropriately because of that, then no question the healing is going to be affected.
Dr. Thompson, always great to have you on. What's the big takeaway? What do you want people to really walk away with today?
The body, and especially the heart, is an amazing thing. And it's capable of spectacular good things as well as bad things. We have a tendency to talk about these bad things. That said, there's equal mechanisms within our body that cause it to recover, that make it do well. So as we go into Valentine's Day, focus on the happiness, focus on sharing joy and reaching out and connectivity, because I really think focusing on the positive things rather than the what ifs and the bad things is really what sets us up for the better.
Dr. Thompson, always great to see you. You can actually go to our website. We have a heart quiz that you can take just to check your heart health. So log on there and put your information in and see where you stand. Get your status on that. Dr. Nawalnik, it is Valentine's Day. Are you prepared tomorrow?
Sure.
Sure.
Yeah.
Okay. Here's my little
covered.
Tip to you.
Got some things to get there?
Yeah. Okay. You might want to get on that.
Fair enough.
Do you remember your first heartbreak?
Yeah, I think if I were being honest, it's probably first grade.
Wow, you were sensitive back then.
Yeah, it was. It's yeah.
You remember it well. Okay.
Yeah.
What is the big takeaway today? What do you really want people to know?
What I think that I want people to take away in terms of, we're going into this Valentine's holiday weekend. Let's make it less about the pressure to put on a big show or a big demonstration. Let's just try to take it from a perspective of gratitude for what we have. Also, if a relationship has ended for you recently and you're feeling hurt and pain, I encourage you to try to move beyond that. And instead, let's look at what can you learn from this relationship? What do you learn about yourself? What do you learn about what you're looking for in a partner? What is the way or ways in which you can grow and develop as a result from this to be better for yourself going forward? And then ultimately, the better you are for you, the better you are for anybody else. And then lastly, I would say I've been really big lately in therapy on non-judgmental stance. And so what that means is, if we look at a relationship ending, we want to look at this. This is terrible. Oh my God, I can't believe this happened. Is it? Maybe it's a relationship that ended that opens you to be available for the person that actually is the best partner for you. Maybe there's something you needed to learn about yourself to be better long-term for someone else. So sometimes what's a negative actually turns out to be a positive. And for those of you that are in new relationships, sometimes that positive might ultimately wind up being a negative. So let's just not put a judgment on it. Let's just be present in the moment and enjoy everything to the best that we can.
And just breathe. Okay, we can do that. We can do that. Always great to have you. Loving your advice. So thank you so much. Dr. Hughes Thompson, again, thank you to both of our guests today. Thanks to our viewers for being with us. Coming up on Monday, a cancer comeback story powered by Breakthrough Care. We'll share how CAR T-cell therapy and doctors at the University of Kansas Cancer Center became Richard Hankins' last hope after his cancer kept coming back.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.